Advocacy, in my experience, is really a process of influence. And that requires leadership, and it requires relationship building. Because people that work in the health sector that are trying to affect healthy public policy change are trying to connect with people in positions of influence that can affect that change, whether that's around policy or resources or just a vision for the future. So advocating for that kind of change, that kind of sustainable change, I think is one of the critical skills for anyone working in the health field that wants to create a healthier future for their community, their organization, who they may be. We receive an awful lot of learning and training around how to advocate, and a lot of that has to do with how we speak and how we present and how we influence. Some of the skills that I think may be neglected sometimes are things like trust building with the people that we're trying to influence, listening. Oftentimes, as advocates, we spend a lot of time trying to convey our own ideas. I think there's great power in effective and constructive listening to the people that we're also trying to influence. And by doing that, we're building trust. By doing that, we're building influence. And by doing that, we get a better understanding of the people that we're trying to work with, better understanding their needs, better understanding their priorities, their experiences. And I think what happens is you build a sense of mutual respect and trust. So as you continue to have those conversations with those individuals, those organizations, those community leaders, I think your ability to affect change and affect their thinking and perspective is really enhanced. I think a big part of influencing policy change is about perspective. So policy, I think, for many people is a rather dry, dull topic. You kind of say, oh yeah, policy. We've got a whole bunch of human resource policies at our company. We have store policies and those kinds of things. And I think people generally view policy as kind of a dry, dull thing. But policy really is about a course of action and a principle of action. So when you think about policy in terms of people taking action, taking a particular direction, I think it's much more powerful because really policy can affect change in a really, really powerful way. So for people working in the health promotion sector, for example, who want to bring in comprehensive tobacco control bylaws in their communities, that's a good example of a policy, I think, that on the surface of it seems rather dry and boring. But the power of that policy on the health of the community is magical. To think that you can move from a place where, if you remember a time when you went to a restaurant or flew in a plane or went to a hockey game in an arena where smoking was ubiquitous, it was just everywhere and you couldn't get away from it, to today where the shift that's taken place in the last 20 years around smoke-free public places has absolutely shifted the culture of our communities and the health of our communities, and that's really the magic and power of policy.